My name is Allison Wolf. I'm the Executive Director of the UC Health Milk Bank. My passion is in helping families and helping babies to nourish our community. I love working with the people here at the milk bank. Everybody has that same passion to help feed and nourish our infants. We know that mother's milk is medicine. And we know that, especially for our ill and vulnerable infants, it's even more important that they're able to receive breast milk. And mother's milk is the best for them, but when that's not available because of maybe the mom's sick or there's other maternal factors that she doesn't have enough supply or isn't able to supply breast milk for her baby, we like to be able to fill those gaps with donor milk to help prevent some significant health outcomes. Hundreds of them a year develop what's called necrotizing enterocolitis, or NEC, which is a devastating bowel disease. And we don't know everything that goes into what causes it, but we do know that exposure to formula can increase the risk of NEC. So the priority milk goes to our NICUs and any ill or vulnerable baby that needs it. A lot of hospitals in California are now offering donor milk in their couplet care or mother-baby units. So maybe mama had a C-section or there was another complication and the baby either has excessive weight loss or low blood sugar or needs a little bit extra, and they're able to give the donor milk to these babies kind of as like a bridge until mama's milk comes in. And then we also provide donor milk for medically fragile babies in the community. So maybe it's a baby with a cardiac defect. Again, mom doesn't have enough milk and that she needs to be able to bridge her milk with donor milk because to decrease that formula exposure. So the milk goes to them. And then when there's enough left over, people are able to purchase milk. So maybe it was somebody who had a mastectomy or a surrogate family or whatever reason that mother doesn't have enough milk, she wants to be able to bridge her milk with a donor milk. They're able to come and purchase the milk here from us. The milk bank is actually located inside the San Diego Blood Bank, and we did that for a couple different reasons. So milk banking, we fall under what's called a HABANA, which is the Human Milk Banking Association of North America, and there are only around 30 milk banks in all of North America, and so it's not a big group of milk banks, and so a lot of our knowledge we actually get from the blood banking community. And so we thought by partnering with the San Diego Blood Bank, we'd not only be able to build these relationships, gain this knowledge, but we also use some of their infrastructure. So for example, they have couriers that go to the different hospitals in San Diego every day to deliver blood. They also help us deliver milk to those same hospitals. We have a portal that people can go on and log into if they're interested in donation. And we have FAQs, how to donate, all these other things, and if they're interested, they create a login and then they have to answer some questionnaires, sign some consents, and then we do about a 15-minute phone interview with them to kind of go over risks, social factors, any medications, health history, all those things that may impact the safety of their milk. And if all of those look good, we get a consent from their OB or prenatal provider. And once we have that information, we go through with either the executive director or the medical director. We look through all the information and say, yes, social factors, health factors, any risk factors, medications, yes, they're safe to donate. So then that's when they do the next step to actually come here to the blood bank and the milk bank to drop off their milk and get their blood draw. They come out, we meet them, we'll come out with coolers, they unload all their milk, we greet them, tell them about what we're doing, kind of introduce them to the blood bank and the milk bank, and then we walk them back through to the blood bank section where they'll get their blood drawn. The blood test is that one important safety step. It's actually the same test that they do for blood donation. So looking for different communicable diseases that could possibly be in the breast milk that could pass to a baby. And so just like before somebody's able to donate blood, they get these same blood tests done to make sure that that blood or that milk is safe for donation. What we do is we take their milk and we actually put it into a quarantine freezer until we get those blood results back. And then once those results come back, it's actually a two-person approval process. So we sit down and we look through again all of those things again, medications, health history, social risk factors, and all those blood results. Double check it with everything, and at that point, if everything looks good, we approve them. And so once that milk is approved, we're actually able to log it into our milk banking system and put it into the freezers that at some point will be able to be processed. let's say they're going to pasteurize and we're going to do 100 ml bottles of protein targets. So a couple days prior, one of our milk techs, who's very familiar with every single mom, her calorie count, her protein count, everything, because we've analyzed all the individual moms, and he'll pull the different bags of what we're going to process a couple days later. You'll see the little pumped samples of milk. Those are thawed for a brief period of time. Each individual donor is placed into a separate pot, and a pre-culture sample is sent to laboratory to analyze. We're looking for any sort of, it's a bacillus screen. Bacillus is a bacteria that if it's exposed to heat actually blooms and grows, so we don't want to expose a batch to that. That's then, again, slowly thawed over 48 hours, and when they're ready to process, they pull out these individual pots of the moms. It's usually 5 to 7 donors. We do pool milk, and that's to get a specific calorie count and protein count, and also to ensure that there is what we call a human milk oligosaccharide, an HMO, which is protective against necrotizing enterocolitis. We want to make sure that there's an adequate level of HMOs in each batch so that we're protecting these vulnerable NICU babies. And then it's turned, you'll see the mixers in the lab, and that's to make sure we mix all the fat and everything in, and then a sample is taken and analyzed. So we'll know exactly how many calories and protein are in that big pot of milk. And then once they figure that out, they're like, okay, great, it's protein target. They're going to dispense it into individual bottles. Those bottles will be capped and then put in the heat pasteurizer. Once that's done, a bottle is taken out and another culture is sent. Those bottles will be put into our blast chiller to quickly cool down and then put into our quarantine freezer until those final culture results are received. One thing I've learned since I've been here is our donors are amazing people, and they do this because they want to help. They want to help others. They want to help families that don't have breast milk for their baby. They want to help other babies. They want to nourish them. And so we see donors from all walks of life. And so we see younger, we see older, we see, IVF, surrogacy. We see a lot of nurses and physicians and OTs and physical therapists because I think they understand the power of breast milk and how that really is medicine. There is a fair group of our donors who actually were able to receive donor milk in the hospital. So maybe their baby was in the NICU, or maybe their baby was in couplet care up at UCSD, and they needed this couple days of bridge milk and they were able to receive it. So a lot of our donors are like, you know what? It meant so much to us to be able to have that gift that we're going to pay it forward, that I want to be able to do this.
When a mother's own breast milk is not available or sufficient for her infant, pasteurized donor human milk from a milk bank is often the next best choice. Here at UC San Diego Health, we are fortunate to be able to provide donor human milk from the University of California Health Milk Bank. Today, we'll learn more about this important resource from Dr. Lisa Stellwagen, a clinical professor of pediatrics and the executive director of the UC Health Milk Bank. Thank you for joining us today.
Oh, my pleasure. Thank you for having me.
So, Dr. Stellwagen, what is a milk bank?
A milk bank is similar to a blood bank. And so we take donated milk from families, from women that have extra milk that their child doesn't need. We process it, pasteurize it, and we feed it to tiny premature babies to improve their outcomes during the weeks and months that they're in the hospital. And this human milk diet, both their mother's own milk or donor milk, if mother doesn't have enough, can really change the outcomes for those babies in the neonatal intensive care unit. And that's what a milk bank does.
So we're eager to know, what is important about donor milk?
Milk sharing is as old as human history, right? But centuries ago, people learned before the time of infant formula that human milk had amazing benefits for babies. And really what's happened in the last 40 years is that we've realized that as good as human milk is for all babies, there's a group of children who benefit immensely from the gift of donor milk. And these are babies born less than 1,500 grams. That's about 3 pounds. So little premature babies, sick, vulnerable babies. If you feed such a baby infant formula, they can end up with a life-threatening complication of their intestines called necrotizing enterocolitis. So basically what we've learned over the past decades is that if we give these babies, when they're little, a completely human milk diet, their mother's own milk preferentially, but if mother, as is often the case, mother might run short. These are sick women that have these micropreemies. If the mother's milk runs short and we give them pasteurized donor milk, they can avoid this complication of necrotizing enterocolitis. So that is the reason that we have milk banks, and that is the reason that we started our milk bank.
Day to day, who runs the milk bank?
You know, it's very different around the world. So there are 283 hospitals in Europe. There are 32 hospitals in North America. Some milk banks are community-based, serving the community and the hospitals in that community, and others, like ours, are based in a hospital setting. So I believe I'm the only physician running a milk bank, and we did that for a purpose. And actually my philanthropic donor came to us for a reason, is that she wanted us to drive innovation and drive research and really think about how we can make our donor milk product better for these micropreemies in the hospital. Because not only are we working to prevent necrotizing enterocolitis, we've got to get these kids to grow because they're tiny and they need adequate nutrition, and that's really been our focus, NEC prevention and improving infant growth. The other lovely thing that happened is that UCSD has had a milk lab for many years. We started it back in 2009, and we hired our milk technicians from the hospital milk lab who, they understand the NICU environment, they understand about the value of milk, and we brought them into the milk bank, and that's who processes milk in our milk bank. So I think really this alignment with the health system has been just really valuable at starting what we consider to be one of the best milk banks.
And take us back in time. How did you get started on this journey of starting the milk bank?
You know, we've worked together at the hospital, and so you know that the supportive breastfeeding in the after delivery has been just an important topic at UCSD for decades. And out of the work done by many other people before you and I came here, came the Baby Friendly Hospital Initiative, helping mothers and their full-term babies get established with breastfeeding. And in 2006, we became a Baby Friendly certified hospital. At that time, our breastfeeding rate at the time of discharge of mother and baby was about 92%, which was very good. Now it's 97%. But what we realized is that the moms and babies that were in the NICU were going home breastfeeding only about 50% of the time. And we thought, oh my gosh, there's this huge gap. Like, what is causing a 40% point difference between healthy mom and baby and the premature baby? And we dove into that environment to find out. And in this, we realized that there was this problem with the use of formula. And we took part in a study, as is often the case at UCSD. We took part in a scientific study, and we implemented donor milk. And that resulted in this great drop in this bowel complication. And from then on, from 2009 on, we've been using donor milk. The problem was, at the time, back in 10, 15 years ago, is there wasn't enough donor milk in the state, and we used to run out. And pulling a baby off of a human milk diet had this high risk of complications. So we had this idea of starting a milk bank. We didn't get too far until 2016, when we were approached by a philanthropic family, a local family, who wanted to do something to improve child nutrition in the county, and we pitched this idea of a milk bank, and they gave us a generous gift to start a milk bank. And at the time, there was really only one other nonprofit milk bank in the state. And we're also unusual in that we're this university academic affiliated institution developing a milk bank. And so that's our story. The gift came to us in 2016, and we launched the milk bank in 2020.
What a tremendous gift to the whole community. So for patients who are delivering, how do they get access to this milk bank, or what's the typical route to having access to the donor milk?
You know, it really depends what we're talking about. In the neonatal ICU at our institution, as in many institutions, any baby who has a medical need in the NICU is offered donor milk if mother's milk isn't sufficient in volume. And sometimes it's just a day or two. Sometimes it's at the beginning of the hospital stay, sometimes at the end. It's offered to everybody whose baby qualifies. It's a little different if you have a full-term healthy baby. What's unique about UC San Diego is that we decided a few years ago to make donor milk access across the board. So any baby born at our institution has access to donor milk. It may just be for a couple days for a healthy full-term baby. In the NICU, it's going to be for much longer. It could be weeks or even months, depending on the medical need of the baby. So this is unique. I think it's evolving across the country, but we've really set the standard of equal access to donor milk. And we asked the family for their consent to use the donor milk. Other than that, there's no payment. It's just provided by the hospital. We always say the mother gets a meal tray and the baby gets the milk that they need.
That's wonderful. How is donor milk different from, as you mentioned before, women have been sharing milk, for centuries. What makes this different?
So, back in the day, the early milk banks, it was all just raw milk. So they would get milk from a woman that had extra milk and they'd feed it to another baby. But there are concerns about that. And really what made a sea change in the donor milk industry was HIV. Because there are some viruses that when they infect the human body, they can get into the milk and get access to the baby. And so pasteurization of the milk, which kills HIV, other bacteria, almost all other viruses, pasteurization became the standard. So this donor milk is donated by people with extra milk. The donors are screened just like a blood donor, lengthy questionnaire, a blood test, constant check-in, and the milk is then accepted, and it's all heat pasteurized and tested for bacteria before we would, present it to a hospital. So there's this lengthy process, and it's informed by the latest science about what we need to do. When COVID came out, it was a good example of, is our donor milk safe? Mm-hmm. Is the vaccine safe in the milk? And we had to answer all those questions so we could keep moving ahead with the donor milk provision for our region.
Yeah, what a time of change for absolutely everyone. Yeah. For somebody who is interested in donating, how can they find out if they might be a candidate?
I always encourage, if somebody's interested, they should just reach out. In our region, we'd love to have them come to our milk bank. We have a portal where you sign on, and we quickly ask you a couple questions and can help people identify if they are able to donate. And really, there's just a minimum donation of 100 ounces. It needs to be milk that your own child doesn't need, which is usually the women that reach out to donate have such milk. It may be a stash of milk that when the pandemic hit, people had saved up milk to go back to work. Mm-hmm. And one of the silver linings of the pandemic for milk banks is that women didn't go back to work, and all of a sudden they had all this milk saved up. And they generously donated to us, and that was very useful when we had just launched our milk bank. The donors aren't paid for their milk. It's really something they do, like blood donation, to help other people. Outside of our area, there are other milk banks in North America, and so just even looking for the nonprofit milk bank in your area would be a way that you could reach out to donate. And there are other aspects of donation too. Some people aren't able to donate for clinical use. Let's say a mother's on a blood pressure medication that we can't accept. But we do take milk for research, and there's a research biorepository here. And so we will channel a mother like that to donate to the research biorepository, because the more we understand about human milk, the more we know about how medications gain access, the more we can help people with their own babies and milk banks as well.
That's great. I didn't know that.
Mm-hmm.
I appreciate that information.
Mm-hmm.
For women who are not currently with the UC San Diego health system, or once they've been discharged, what would your recommendation be if they were interested in trying to get donor milk?
First of all, to clarify that anybody in our region can donate to our milk bank. You don't have to be a UC patient. We have milk donors from Arizona and Northern California, all over. So we welcome all the donations. But let's say a family has, the baby goes home. It may be a medically fragile baby. It may be a family that wishes to avoid formula exposure. We do sell donor milk we don't make a profit from it. We're a nonprofit milk bank, but we sell it for a processing fee. And people can go, again, onto our portal and inquire about purchasing donor milk. One of the issues is there's a lot of safety steps in preparing donor milk, so it is rather expensive. It's about just under $5 an ounce. Wow. So for a lot of families, it would be too expensive to completely donor milk feed a baby. But some families buy a few bottles. They might do it before delivery. We can talk about when that might be of interest. Or after delivery, they just want to buy a few bottles to get through those first few days as mother builds her milk supply. And we're really happy to provide that for the child. All you need to do is to access our portal, to ask about it, and find out if you can pick up milk at the milk bank or have it shipped to you if you're out of area.
That's a terrific resource. So I'm going to take you up on that. So tell me about who should be thinking about this before they even deliver.
The medical information about the importance of donor milk, as I mentioned, is for this micro-preemie population. Some other kids, like kids with complex heart disease, babies who have had bowel injury, those babies can all benefit from donor milk in the hospital. Once children go home, nobody has done that study. I think it's sometimes more of an emotional thing. I want to avoid formula. I also want to give my baby the best start. People are really so much more informed about human milk than they were when I had my children, for sure. And they're aware that there are things that help the baby build the right balance of bacteria in the intestines. So an example would be a woman that had a bilateral mastectomy for breast cancer. There's no way she's going to breastfeed her child. But she may want to do some amount of donor milk for the first few weeks to give her baby that biology, and we're very happy to provide donor milk for that. And she can arrange it before delivery, so coming home from the hospital, she can transition the baby to getting, and it doesn't need to be all donor milk, but maybe a feeding or two a day. Mm-hmm. The same for families who adopt a baby. Some families who have a baby via surrogacy, they may have had the baby out of area, or the surrogate wasn't able to provide milk. They may be willing and interested in purchasing donor milk. So for all those reasons, we provide this as a service to our community. But our goal, I always like to be really clear that our North Star are these preemie babies and medically fragile kids in the hospital.
That makes sense. So what I'm hearing you say is that we have every reason to think that donor breast milk, even for term otherwise healthy neonates, likely has similar health effects as, mom's breast milk over formula. Is that?
We just don't know.
We don't know.
I think those of us that are true believers in human milk think it might, but nobody has done that study.
Okay.
So it really, in some ways, it comes down to almost an emotional thing. Mm-hmm. But I'll tell you that in the hospital, when we implemented donor milk on the mother-baby unit, this was about 2018, it used to be there were kids, like the same kids that I mentioned, the mothers that had mastectomies, the women that living with HIV, a family with an adoption, those kids would get only formula fed in the hospital. The first day or two of formula feeding for a newborn, it's a little hard to watch. The babies don't tolerate the formula well, they throw up, their belly doesn't move well. And when we suddenly made a move to donor milk for those kids, they just were so much more comfortable. So just the transition to that first feedings, I think, was really different. But again, what happens after they get home, a month or two out, we just don't know. I think there are probably some benefits to the milk, but it just hasn't been studied.
Are there ongoing studies that UC San Diego is doing?
I have not heard of that yet. It's something that needs to be studied. The focus right now is in the NICU because you might be surprised to hear that we know a lot about the micropreemies and what donor milk does. But even for the kids with complex heart disease, the babies with bowel injury, very few studies have been done showing that it's important. Those children are also at risk for this bowel catastrophe I mentioned called necrotizing enterocolitis, and that's where we need to focus our energies right now. In the future, I think we'll know more about that. The other interesting thing that's happened with the donor milk use in the hospital is that in the NICU, the families that don't have enough milk, they usually don't end up with a lot of milk or end up donating milk. But we're using milk for a short-term supplementation for babies that have a low glucose or jaundice. And those families go home and usually build their milk supply, and they are now coming back to donate milk. So there's been this lovely circle of women helping feed other people's children, and then it coming back, and they circle back to donate. It's been really a lovely part of activating the community about the importance of human milk and also just helping other families feed their children.
That's lovely. Does insurance coverage play any role with the milk bank?
That is a fraught question.
Oh.
So in the hospital, providing donor milk or any kind of nutrition is part of what is called like the bundled coverage that you get in the hospital. But because there isn't insurance coverage by and large in the hospital, it's really delayed hospitals that aren't using donor milk to implement it. So we're working in that space, especially with our Medicaid population in California, to see if we can't get insurance coverage and help hospitals step up. From what I told you, you'd expect that every single NICU in this country would offer donor milk, and it's just not the case. And about a third of hospitals in the United States don't offer donor milk to those little preemies, and it's not right. And our goal is to drive the milk provision so we can meet the need and to get hospitals to step up, and it would be good if they could bill insurance. So that's in the hospital. Once families go home, if it's not medically necessary, it's not going to get covered. But there are some of these fragile kids from the NICU that at the time of discharge just can't tolerate formula. So babies that don't have enough intestinal surface area, babies with a cardiac disease, and in some cases the insurance companies will cover the donor milk, but it's tough because insurance companies don't like paying for nutrition, understandably. So it's really, those of us in the field think of milk almost as a medicine and that they should cover it, but there's that friction between the insurance companies and what the baby needs.
I see. I've worked with patients where, either when they've had the experience of a stillbirth or lost their baby, where they ask what they can do with their breast milk. What would you tell those mothers?
We've structured a specific program about this because back in the day when somebody had a baby die, shutting off the milk supply was what was done. And just this lack of appreciation for what it means to a woman to make milk, to feel like a mother, even if her child has passed, I think has really come forward. And now there's this interest in helping people have this healing experience, and it's such a healing experience. It's not an easy time to go through the donor approval, but what we have found is that about 5% of our donors are bereaved families, and producing milk and helping to feed other people's children is such a gift for them. And we work very hard at and calling them a mother. We use the baby's name, and we talk about this legacy, a gift that she's giving with her deceased child. And we really try to shepherd that and help these families pursue donation if it's right for them. There's never pressure. This is something that some people like to do for a few weeks as they heal, and other people do it for longer. And as one family said to us, this was the only good thing that happened from the loss of that child, and it just can be really healing for them. And that was a silver lining of starting a milk bank that we never expected. So it's been quite impactful on all of us in the milk bank, and I think for these families as well.
Would you tell us a little bit more for the preemies that have the risk of bowel complications? Will you tell us about necrotizing enterocolitis?
I was just at a 4-day conference about necrotizing enterocolitis. It's really this disastrous complication of prematurity. And back when I was a young doctor, the tiny preemie babies, the tiny ones didn't survive. We weren't able to take care of their lung disease enough to get them to survive. And things have changed. And babies are surviving now down to 23 weeks gestation. But they are very fragile. And up to 10% of the tiny babies and 4% of all the preemies I told you about can have this bowel complication. The thing that's different about it and heartbreaking is also it's not when they're first born and they're sick and you're trying to stabilize their lungs, and it happens when they're doing well and they're starting to recover and they're 4 to 6 weeks out and we're feeding them and everybody's taking a deep breath and they have a sudden onset of a problem with the blood supply to their bowel. They can lose bowel tissue. And of the babies that have really significant necrotizing enterocolitis, half of them will die of that disease. And the trauma doesn't even end there, because of the children that have that, the massive inflammation and infection ends up to other complications. They can end up with cerebral palsy because they had necrotizing enterocolitis. So what's the number one thing we know that helps to prevent NEC? It's not 100%, but the number one thing is a human milk diet. Mother's own milk is best, donor milk if it's not available. After that, there are some other things that are being looked at in terms of preventing necrotizing enterocolitis. But if we could blanket all the NICUs in this country with human milk, we would decrease the rate of necrotizing enterocolitis and the burden that it places on the child, the family, and society. It's really a terrible disease. And that is why we started this milk bank.
Well, thank you so much for spearheading this for the San Diego community. And as a parent, I feel so grateful to you, to everybody who worked to get this milk bank going. And I'm happy to know of all of the families it'll continue to serve. Thanks for your time.
Thank you very much.